Healthcare is often said to be old-fashioned and resistant to change. I don't believe it is. It is, however, resistant to change without clear, measurable and realisable benefit, and is a powerhouse of innovation. The World Health Organization reports that global health spend was $8.3 trillion in 2020, or approximately 10% of world GDP pre-pandemic. So health represents a huge potential market. COVID has a huge tail of consequence, both in financial terms, but also of delayed care. Increases the number of elderly with high healthcare demand, and in many countries, significantly challenging the available capacity. There are not enough trained doctors and nurses across the world with capacity to meet the current, let alone future demand. Training more takes many, many years. The fact is that we are facing a shortage of capacity, and tech support is essential to increase their effectiveness. The COVID pandemic has challenged healthcare across the world, and most countries and systems are now struggling to catch up with care that was deferred during the crisis. There are many models of healthcare provision across the world, some of which have benefit from the patient staying healthy, and others of them getting sick. Politically funded and insurance-based systems have an event horizon that is often measured in a small number of years, as opposed to the decades that may be needed to reap the benefit. For example, improving the management of a teenage diabetic will reap benefit in the terms of reduced complications some 3 to 4 decades later, increasing working life contribution to healthcare costs, but may also increase life expectancy and healthcare needs in the long term. Working out who pays for change and who benefits is not always easy, but must be understood. Focus on real benefit delivery will be rewarded with success. So let's see what digital transformation can bring to the industry. Let us consider data. The most effective medical record holds detail of all examinations, treatments, interventions and investigations from birth and throughout life, while ensuring any part is rapidly accessible and perhaps predicting what will be of most value to the user. So who owns the data within the medical record and where is it held? There are a variety of legal and other constraints which vary across the world and need to be navigated. Europe regards medical data as highly sensitive and has perhaps the tightest restrictions around its storage and access. The clinician needs the right information in the right place at the right time. It is also vitally important that it is clear whether all the information is available or what is missing. This is compounded by many tech providers wanting to hold and manage data they are generating or need to work. This leads to fragmentation of the record and the further potential that information is not up to date. This is a common issue with many tech implementations, where different medical records are held in different supplier systems. A proposed solution is that everything is held across a single healthcare system, is provided and interfaced from a single supplier. The reality is that not even the IT giants, Microsoft, Google, etc., are able to deliver such global integration, and it could stifle implementation of innovation and improvement. Suppliers will be successful when they learn to release and share data in a secure and effective way with others. The data held also need to cope with evolution of operating and display systems and not become out of date. By contrast, paper has not evolved much in the last millennia. Past lessons have yet to be learned. So, for example, the 3M capital hip failures were hugely challenging to track down and resolve. 3M only held incomplete records. The current concerns about mesh implants from a variety of companies is ongoing and challenged by lack of accessible records. Properly structured records would alleviate these issues. There are many other challenges in healthcare provision. where very large amounts of data need to be moved, for example high-resolution 3D scans, and shared in an environment which is tech unfriendly, for example water, other fluids and cleaning requirements, and can be faced with multiple Faraday cages and resultant poor networks. It is also important to engage with context. We can measure many physiological variables with wearable tech, which may, for example, log blood sugar levels. The value of data in isolation is much less than within context. For example, when last insulin was taken, the nature of that insulin mixture, and the relationship to food, exercise, sleeping, etc. Tech solutions need to enable the capture of a broad range of contextual data. The commercial world needs to engage with and better understand the benefits of a different approach to data sharing and management. Medicine has shown how rapid progress can be made by sharing data freely and without restriction in the world response to the COVID pandemic. This has crossed and ignored commercial and geopolitical boundaries, and this approach needs to be taken as core to how we approach data for the future, for the benefit of all. So what of the future? The only certainty is that it is impossible to predict with certainty. However, there are perhaps areas that are more worthy of attention. Genetic susceptibility is already gaining attention, and I will not explore this further here. Screening may be very amenable to future tech, and provided screening costs are low, an effective avoidance of major healthcare demands or early preventative intervention delivered, then benefits are likely to be very real. Ultrasound screening for abdominal aortic aneurysm, enabling elective, potentially minimally invasive intervention, is an example of such a process. Screening by smell is one example which needs attention. Dogs have demonstrated that they can detect a variety of cancers and Parkinson's disease long before they would normally be identified clinically. Tech is ready to go mobile, wearable, and able to integrate data sources to provide context and increase the value. Taking the information to the individual rather than having to find a workstation and log in, just of itself saves a huge amount of clinician time. AI can help with the sorting and sieving of data to maximize the performance of healthcare professionals, for example, drug screening for new treatments. There is much potential innovation in medicine, which can, if supported by the right tech with the right approach, benefit patients, healthcare providers, and tech providers in the short, medium, and longer term. It is not something we could see, it is something we must embrace if we are going to meet the demand for healthcare worldwide. It should be a win for all. I hope that this short discussion of my thoughts around trust in tech have suggested that there is great potential for delivering benefit by implementing tech in healthcare, and perhaps where some of the pitfalls may be avoided. Let's all learn to work and live together, share data openly and enthusiastically, and make this world a better place.